Excuse me. I decided to make this video because a few months ago I had what is described as a mini stroke, and the immediate effect it had upon me was that I found it very difficult to talk. The very first day I couldn't get any words out, and it actually made me break down a little bit and become very tearful, and my wife gave me a cuddle. And when I was in the hospital, when I was in the hospital being monitored, you can see now I'm having problems. But I'm making this video because I thought this might be good for me, because I haven't been talking very much to anybody at all for a long time. I more or less keep in, I hardly talk to anyone because of the difficulty of finding the words and getting the words out. I'll put this light on. Okay, oh dear. It might be that because I haven't been speaking very much for some time, that this will help me to become more fluent. I'm not sure where to put this light. Okay, a mini stroke is just a lack of oxygen to the brain. But I was only in hospital for overnight, and then they gave me one tablet. One tablet, which I think is like aspirin, and if I can find it. Oh no, it's not. Is it in this box? No, I think it's in the other box. You wait a moment. I should say that I'm 80 years old. 1939 I was born. I think I'm beginning to feel even now a little bit better talking to you. I'm trying to relax. I'll show you the. This is like an aspirin medication. I put it close so you can maybe see it. Oh, yeah. Yeah. It's one tablet a day. This is like an aspirin. This one is called Primaspan, but I think it's basically an aspirin tablet. And this is quite a small dose, and it's one a day. Oh, I've already taken it, so I don't want to take it again. So I'll put that away. And also, I thought while we're talking about medication and we're talking about health in general, I should give you a little bit of my history. Was that when I was well, my first time that I think as a child I had oh yes, when I was born I had pneumonia, and I got over that. No antibiotics in 1939, and the National Health Service started in 1948. So before that time, in theory, you had to pay for your medicine and to see a doctor. But anyway, when I was 4 years old, I had a serious ear infection, which couldn't be treated without them removing the bone from behind my ear to get to the source of the infection. And there was no antibiotics, but it was successful, and I was in hospital for 3 months, and they wouldn't allow me. I was in a ward. My mother couldn't come to see me. She could only look at me through the window because I had a problem with eczema, which came all over my face. And of course, when you're 4 years old and you're a child, eczema is itchy. You want to scratch it. So they put my arms into splints, so I couldn't possibly scratch my face. So presumably they would have to feed me as well. But anyway, when my mother came, evidently it upset me so much that I cried for so long that they said to my mother, it's best if you don't visit, because it upsets Bobby. I'm Robert, but when I was a boy, I was Bobby. It upsets Bobby so much. It's best if you don't come. So I was in hospital for 3 months. After I came home, I had a bad stammer, which is odd because I'm now at 80 and I've got a similar problem getting my words out. But they sent me to a medical centre. I don't remember exactly what, but there I remember the one thing they did was they put electrodes in my ear to dry up the discharge from my right ear, and then for the stammering, I believe they had music and we would dance to the music, like not proper dancing, but just enjoying the music, and that was, I think it was quite beneficial, and my stammer was more or less cured, but it in times of stress it would return, and I would always have to also with my name Gawley, Gawley, in class, if a teacher said what is your name, I couldn't say Gawley for some reason. It was very difficult to say Gawley. It was g. I don't know why. I had a mental blockage about my name, for one thing. So that is about stammering. So, but anyway, my hearing was okay. I got over that okay. And the next time I became seriously ill was when I contracted Crohn's disease, which is an inflammatory disease of the bowel, and I was very ill. I was 6 months in the hospital. They weren't quite sure what was wrong, but eventually they performed surgery on me, and it worked. And the morning after the surgery, when I came round from the anaesthetic and the doctor came round, the surgeon, the actual surgeon who did the operation came to see me, and he said, how are you? He didn't stammer. He could speak quite well. He said, I'm so sorry. He said, how are you? And I said, fine. And I remember waking up that morning, and for the first time for 6 months, I had no pain. I'd been in that bed. I'd been in bed so long I couldn't walk because I'd been bedridden for 6 months. But when I woke up in the morning, after the anaesthetic, and I woke up, my first immediate thought was, I'm pain free, the pain is gone. And I believe this, the nurse came and said, would you like it? I think she brought me a drink. It was a very tiny um, stainless steel cup, very tiny, with water in it. And she said, you can have this. This is the first water that I've been allowed to drink for um, many, many days, because I've been on a drip. You know, a drip, it goes into the vein. They had a lot of trouble. I went down, when I was 15, I went down to about 40 kilos. I had lost a lot of weight and they had trouble getting into a vein. And they tried this. You can, I'm not sure if I can still see the scars, but they tried various places in my body, and eventually I remember there were this young doctor. I can picture him now. He didn't look to be more than about maybe 24, 25. Ginger hair. Yeah, I remember him now. He had ginger hair, and he couldn't find the vein, and he was starting to cut into my arm with a knife to cut down to find the vein. And this, honestly, it wasn't so much it was painful, but all this repeated attempts to try and find a vein. It's the only time that I can remember that I snapped. And I didn't normally use bad language, but I said to him, look, just fuck off and get somebody else that can do this. And he looked at me and just went. And somebody came and they put a vein into my ankle. They did have to cut a little bit, but this person knew what they were doing, and they got the drip into my ankle. I still got the scar, but I'm not going to show it to you. So that was when I was 15 in 1945. I was fine then. I had lost some of my colon, of course, but and I had medication to control my bowels, more or less from that time, from the age of 15, on medication. And I seemed to be okay for about 10 years until I was about 25. And whether it was a coincidence, but when my father died in a car crash, I had got married, I bought a bungalow, married with 2 children, and my health, my stomach problem kind of recurred, and it was very difficult to know what to eat or when I could leave the house. So from that time, I more or less became self-employed because I could work when I felt well, and I worked for myself, doing various jobs. But I want to talk more about the medical situation. I hope I'm beginning to talk more fluently. Talking to you now, and you can see that this is a very good exercise to make a video, even if you don't publish it or put it anywhere. It's good practice, and I'm going to show you. So at the age of 25, I don't think I had any serious health problems. I worked in the Middle East for a couple of years, and I became quite ill there. And I went to see an American doctor in Jeddah, in Saudi Arabia. And when he knew that I had had Crohn's disease, and I was still making medication for it, he said, you're in the worst possible place in the world to be with Crohn's disease. So it wasn't long. I had one of these bouts which lasted. I think I also picked up an infection, possibly because I always drank the bottled water, but I think maybe at one time maybe I didn't, and I became quite ill. And but it's a long story. But anyway, I came home from Saudi Arabia, and I'd been married 20 years. 4 children. Something had happened while I was away, and the marriage broke down, and I was a year or two until I met my present wife, and then moved to Finland in 1988. We had a son, and I remember I still had this problem with my bowels, and I had to be quite careful what I ate. And some days I was okay and some not. But most of those times I worked for myself, and I could usually work most days. But if there was a bad day, then I had to stay home. But anyway, after I had a very happy life in Finland, and I used to hunt, used to fish, used to go ice fishing in the winter. It was a very nice life, in fact, really beautiful country to live in. And I'll get to the next health problem, is that maybe, I remember when I was about 65 years old, this is 15 years ago, I was driving, and I suddenly began to become conscious that my right foot was very sensitive when you brake or you use accelerator in the car. And that was the beginning of a diagnosis that I had neuropathy, which affected the nerves mainly on my right side of my body. And that's 15 years, and it's gradually got worse. And I had quite bad back pain as well for 20 or 30 years, which I thought it had been caused by a fall from a truck when I was pulling down on the ropes, tightening up the ropes on top of the load on a big truck. The rope had broken, I'd fallen on my back, and I'd laid on the ground, being unable to move for about 20 minutes because the pain was so severe. So I always assumed that this back pain had been caused by that fall. But the next stage is I had a doctor doing blood tests, and then they diagnosed I had kidney disease, not acute but chronic. It's measured by the creatine level in your blood. So then I was put on medication for my kidneys, and the first one of the, I think they gave me, yes, I think because, anyway, I'm taking one medication which is Creon, if you can see it here. Sorry to Creon. That is an enzyme which, I take this because I can't make the enzymes that I need to digest the food, so that helps quite a lot. The kidney disease, it's the first reading I ever had of the creatine level was 208, and it has been as high as about 300, but now it's slightly lower. And they offered me the choice of having dialysis, but when I thought about it and weighed up all the options, I decided that I wouldn't do that. So I just decided to cope the best way I could. So this is another medication which was prescribed by the kidney doctor. You can see this one. That's a kind of calcium. And then this is only a vitamin. Sorry to vitamin. Yep. And this one here, this is to, I used to get a lot of burning in the stomach. this stops the production of so much acid in the stomach, which causes stomach pain and heartburn. This one here, what is this for? These are very small tablets. Oh, this is to lower the cholesterol. Yeah, that's to lower the cholesterol. And then this one is to control the blood pressure. It's very important. My blood pressure is good, and then I also have, let's put some of these away. I also have a prostate problem. It causes prostate. I think they're considering doing some operation on my prostate, which will make it easier for me to wee. And yeah, but because of the coronavirus, I think that's all been put on hold for a while, and I can manage okay. Then there's 2 tablets here, which are, there's one, there's another. One is white, and these are for my prostate. I don't exactly know what they do. I think that's to help my prostate. That is vitamin C. Yeah, vitamin C, which is good for your immune system. Omega. Sorry, the reason I'm showing you this is that I probably don't eat. My diet probably is lacking in some things, so I take a lot of supplements. So this is I can't get it right. I keep turning it the wrong way around. Oh, big vitamin, multivitamin, and this one is another blood pressure medication. I take one in the morning, one at night, and my blood pressure is good. I think that's gone through all my medications. So did I do this box? I think I showed you the aspirin. Oh, this is very important. Magnesium is very important. Paracetamol, which for back pain. Oh, about back pain. My kidney doctor, when my pain became so bad, she removed my legs and it was so painful that they did an MRI scan and they found I had a tumour in my back, about as big as my thumb. And it was not quite in the centre of the vertebrae, but very close. So the surgeon said, I can remove that for you, but he said you may have a problem. You may have a side effect of it. Could give you a limp. And they did the surgery, removed the tumour, and it was benign. It was not cancer, it was benign. And that was about 3 years ago. And now I'm only recently beginning to have trouble with my right leg. When I get dressed or undressed, I have to lift my right leg with my hands. So, but that's all. So, all going quite well now. At the moment, my stomach is quite good. So, oh, this is quite a good medication. This is Librax. That's like a tranquilizer for the stomach. It's quite good. Oh, another medication, Triptyl, is supposed to be for depression, but it's actually the only one. It's an old medication for neuropathy. So you can see that I've got quite a few health problems, but my heart is very good. But my lungs are good. I haven't been out of the house for about almost 6 months because here in Finland it's been cold, and I can't be out in the cold air because I've got this problem with my lungs. I've got medication. Oh, my lungs! I've got COPD, which I'm not sure. It's chronic disease of the lung, and I've got medication for that. This is quite good medication. This is spiriva, and also asthma. So I've got I've got so many things. But anyway, that's it. And oh, I'm quite tired now by this talk. So if you watch this, no matter how old you are, life is still very much worth living. And I'm going to say goodbye. Thank you very much for watching, and bye bye.